All right, 11:01 it is. Thank you, everybody. So my name is Marion Chua, and welcome to Comcare's Employer Information Session for Before Blue. I am the Director of the Mental Health and Research team within the Strategic Partnerships and Engagements groups at Comcare, and I'm pleased to be your host for today. So, on behalf of Comcare, I would firstly like to acknowledge the traditional owners of the lands in which we are dialing in from today. I am in Melbourne, rainy, cloudy Melbourne. So I would like to acknowledge the Wurundjeri Woi Wurrung and Boonwurrung Boon Wurrung peoples of the Eastern Kulin Nation. I would also like to pay my respect to elders past and present, and also extend that respect to other First Nations people who are present on the call this morning. So before we begin, we'll just go through a little housekeeping. A reminder that this session is being recorded. However, only the presenters and slides will be captured. We will also stop recording before the dedicated Q&A time towards the end of the session. So if you have any questions throughout the session, feel free to pop them in the chat. Feel free to raise your hand as well, but we'll make sure that we can get to them certainly by the end of the session. Now, on to the agenda for this morning. The next hour, we will talk through the Before Blue program. We'll firstly start with what the data is telling us about mental health and how this relates to workplaces. And that will set the background as to why Comcare has invested into this program. We will then have Marcia Harkins joining us from Before Blue. Marcia is the General Manager of Early Intervention and will provide an overview of the Before Blue service and the return on investment. Marcia will also talk about onboarding and implementation support, as well as the ongoing reporting that each agency receives from Before Blue. We're also really fortunate. We have Jessica Wright from CSIRO and Kirsty Watson from the Department of Employment and Workplace Relations joining us as well. And they will share their experience of participating in Before Blue as an agency. And then we'll explain to you a bit more about the role that Comcare plays in Before Blue, the effectiveness of the service from our viewpoint, touching on privacy and data protection, and then finally go through any questions that you may have or that we haven't answered in the chat. So in terms of mental health data, we know that mental health challenges are widespread, and the recent data shows us that nearly half of all Australian adults will have experienced symptoms of anxiety or depression in their lifetime. And more concerning, 1 in 5 adults will experience a mental health illness in any given year. And so these numbers reflect the lived experiences of our colleagues, our friends, our families, and really, I think, emphasize the urgency of our collective response, not only it being a community responsibility, but also a workplace responsibility. Nationally, across all compensation jurisdictions, we're also seeing this pattern of increased numbers of claims for psychological injury being mirrored, and the Comcare scheme is no exception. So psychological injury claims are at a 10-year high across the Commonwealth, and these claims now account for 53% of overall claims costs, with longer periods of incapacity as a result of poorer return to work rates. The average cost, as you can see there, for a psychological injury claim is currently $370,000, which is more than 4 times the average for a physical injury or disease claim. Mental health conditions are also now the most prevalent type of workers' compensation claims within the Commonwealth. And so what we're seeing there in terms of recent trends that are continuing this upward trajectory in terms of the number of claims and in terms of the proportion of them as well within the Australian government sector. And what we mean by that is that they accounted for 44% of all the claims received in the 24-25 financial year. You can see there that 34% of all claims are accepted, and as of June 2025, 42% of them remain still open. These numbers are all up by about 3% compared to the same time the previous year. We're also continuing to see poorer return to work rates, as you can see there, 57% for a psychological injury claim compared to 93% for a physical injury claim. So we know prevention and early intervention is the key, but these statistics are also telling us that what we need to do needs to be different, look different, presented differently as well, which really leads to Comcare's partnership with Beyond Blue. Creating mentally healthy and safe workplaces, preventing psychological injury, they're the forefront and centre for Comcare. And so we know that mental health doesn't exist in isolation. It affects every part of a person's life, both at work and also at home. And it's also essential that we're supporting people across that full spectrum of mental health. So if you're thinking about that mental health continuum, that is right from the prevention to early intervention, right through to ongoing care. It's really about creating workplaces where individuals can thrive, bring themselves to work, their whole selves too, and also contribute meaningfully to their teams and organisations. And it's complex, which is why we need to try a different approach. So in 2018, Comcare began exploring an early intervention mental health program that could bring employers within us, that we could bring employers to employers within our scheme, I should say, and that would be effective in making real positive change to workplace mental health, which leads us to Beyond Blue. Beyond Blue is a trusted provider of mental health support and a leading voice in shaping Australia's mental health landscape, delivering such a service within community at that time called New Access, but we know of it today as Before Blue. I'm just about to hand it over to Marcia, and she will speak a bit more shortly on this, but in terms of the journey that really led us here, you can see that we piloted the New Access program 6 months. It was 2 agencies, fairly contained, 50 participants. That was in 2018, 2019. We then expanded it because we saw extremely promising results, and we deserved that it deserved a bigger, broader scale. And so that led us to the expansion trial with 16 APS agencies across the 2 years. We saw the results that were demonstrating real impact in terms of supporting mental health in the workplace. And now we've been able to partner with Beyond Blue. We do recognise that it is a service that agencies beyond those participating in the trial would benefit from. And so to enable this, we've established a deed of standing offer with Beyond Blue to deliver what now is known as Before Blue. And this deed of standing offer really streamlines the process for employers. It removes much of the administrative burden, makes it easier for agencies to offer the service to their employees without having to manage the complex procurement paperwork. And with that, I would like to introduce Marcia Harkins, General Manager, Early Intervention at Beyond Blue. Marcia is an experienced community service development and delivery leader. In the past decade, she has headed up social enterprises at Uniting Victoria, Tasmania, and has led Beyond Blue's workplace mental health, community engagement, partnerships, and lived experience portfolios. Marcia is passionate about finding strengths-based approach solutions to life's challenges and is an advocate for equity of access to services. Welcome, Marcia.
Thank you, Marion, for that lovely introduction, and thank you to Ervika, who's running the slides for us today. Hello, everybody. As Marion said, I'm Marcia. I'm very, very privileged to be able to work at Beyond Blue, along with a wonderful team of people. And I'm joined today by my colleague, Tara Woodfull, who's our Business Development Manager for Before Blue. I'd also like to shout out to the agencies who are here today, who have already signed up and who are happy to answer any questions you might have about what Before Blue does for them. In particular, Jess from CSIRO and Kirsty from DUA. I'd also like to echo Marion's acknowledgement of country. I'm joining you from Boonwurrung country in southeastern suburbs of Melbourne, where it's cold and rainy, unlike other parts of Australia. And I pay my respects to all elders past and present in this region. And I'd also like to acknowledge Aboriginal and Torres Strait Islander peoples on lands from which you're all joining us today across the country, including where Beyond Blue's head office is based, which is also in Melbourne on Wurundjeri country. And finally, I'd like to acknowledge those of us living with anxiety or depression and their families, friends and supporters, especially those impacted by suicide. The work Beyond Blue does every day is for you. So firstly, I'd like to have a little chat to you about what Beyond Blue does more broadly before we get into Before Blue. We're very generously funded by Commonwealth, state and territory core funding. as well as donations from philanthropy, corporates, and the community. Our vision for some time has been to help all people in Australia achieve their best possible mental health. And our 2023 strategy is capsulated in these three words: earlier, easier, together. When it comes to earlier, we believe early intervention is crucial because it helps people manage mental health issues before they escalate into more severe problems. So providing support early, we can reduce distress and prevent mental health conditions from worsening. And as for easier and together, we're really committed to making it easier for people to access mental health support. And we do that by providing user-friendly digital tools, streamlined services, and clear pathways to care. So we try and ensure help is always within reach. We actually really believe in the power of government, community, and collaboration. So we do it together with others. And by working closely with the community and our government, corporate, and sector partners, we actually try and create tools and systems that work for people and provide easy access to support where and when people need it. In terms of our services, they include our 24/7 support service, which people can access via phone or web chat. We also have our BU National Education Initiative, which is a special program working to equip educators in every school and every learning centre in Australia. And that's actually funded by the Department of Health, Disability and Ageing. We also have online peer support forums and our website, of course. And finally, we also deliver the low intensity CBT service we're going to talk to you about today across three main settings. So there's a community setting, which is still called New Access, and that's funded by PHNs, mainly in Queensland and New South Wales at the moment. There's the small business setting, which is called New Access for Small Business Owners, or NASBO. It doesn't really roll off the tongue, but NASBO is a bit easier. And that's funded by the Commonwealth Department of Treasury. And then finally, the workplace setting called Before Blue for workplaces, which is what we're going to talk about today. And we offer on a fee-for-service basis to both public and private sectors. But before we get into that, I thought we'd expand on some of the stats that Marion has provided around the state of mental health in Australia, with a focus on the impact in workplaces, the cost of productivity, and the exponentially increasing claims for mental injuries. And I'd like today to start the conversation by really thinking about what can we do to create mentally healthy workplaces here. And Beyond Blue, our view is that the key is to ensure people have good work. Now, what does that mean? Well, good work gives you a sense of meaning and purpose, a sense of connection, and of course, it also gives you financial means. And it can be a place of support and recovery. So I think we too often look at work with a lens of it being a place that can cause harm, but it can actually also actively support people's well-being. And that means creating a positive culture where people feel valued and included. It means managing stressors like workload and deadlines. It means supporting people with mental health conditions to stay at or return to work. And it means taking a zero tolerance approach to discrimination. So these aren't nice to haves, they're actually essential for a thriving, productive workplace in our view. And this is where the service Before Blue comes in. So the low intensity cognitive behavioural service that we're offering you can support your people to nurture a really positive work culture, to manage stress and mild to moderate mental health conditions. And it can also support you to support a zero tolerance approach to the things that negatively impact people's mental health. So what is Before Blue? So we try and sum it up in one sentence. It's basically an early intervention service, a coaching service that employees can access easily and confidentially in a similar way that EAP works. In fact, we regard Before Blue as a complement to EAP. It's an early intervention service that's designed to help people build resilience and equip them with tools to manage their mental health before things get out of hand. So you can see here the mental health continuum that we all move around on in our lifetime. And Before Blue can really work with people across the sort of healthy to unsettled and then just getting into that struggling space. The foundations of Before Blue are really, really firm. They're a proven evidence-based framework. So that's low intensity CBT with 12 plus years real world application and success in Australia. It's a support plan designed to help people actually change unhelpful thoughts, feelings, and behaviours. And it's structured, it's consistent. It takes a real skills-based approach over about 6 weeks to really build sustainable mental health outcomes. And it's supported by practical tools and resources. And participants also get real-time feedback, reporting and progress tracking, and their organisations get some really great confidential de-identified outcomes reporting. So the model of care isn't new. So as I said, the LICBT model has been in Australia since 2013, when Beyond Blue introduced it into the Australian context and called it New Access. And there was a trial that was evaluated by Ernst & Young at that time. Where does it come from? The model was actually adapted from the UK National Health Service's Talking Therapies for Anxiety and Depression program framework, which is another mouthful, and it's delivered by a trained coach workforce. So it's a really, as I said, structured intervention. It actually co-designs a treatment plan with participants and it coaches them over a series of sessions to change whatever unhelpful thoughts, feelings, or behaviours are manifesting. And it also monitors their mental health outcomes. So it's a proven approach. It helps people to recognise the triggers, the thoughts and the feelings that result in certain behaviours and reactions, and then actually tackle that through some practical exercises. Progress is measured and tracked at each session, which really keeps people accountable, sort of like a personal trainer would for physical fitness. And there are also 1 and 6 month follow-ups to ensure sustainability. Just on the model of care, the LICBT model of care has 3 key domains that work really closely together. So the service domain is really about what's required to deliver the service. It's about the service operations and ensuring good clinical governance is in place, the right processes to make sure the service is safe and effective, and it's adhering to a care pathway that's really consistent with the evidence that the service is based on. And then the second domain is the treatment domain. So that's really about how Before Blue is delivered. And that really ensures the faithful delivery of a really person-centered, outcome-focused model. And it also makes sure that, the right things are in place, including consent, treatment structure, risk assessment, and documentation. And then finally, the workforce domain, and that's about who delivers Before Blue. And we have an in-house workforce of mental health coaches. We pay a lot of attention to how they're recruited, how they're trained, how they're supervised to deliver on those service and treatment domains. And you can see here the 6 principles that the domains are underpinned and reinforced by. And of course, the service has received accreditation as well under the National Safety and Digital and Quality Digital Mental Health Standards, another mouthful. As I mentioned on a previous slide, the program is a really excellent complement to other mental health supports, in particular EAP, and we're often asked the question, what's the difference between Before Blue and EAP? And there's lots of different EAP offerings out there, but generally EAP is a broad suite of services which can vary significantly, but they usually offer counselling and psychology support for immediate or one-off issues. Before Blue is quite different. Firstly, we have a very specific workforce of mental health coaches. So they're trained specifically in LICBT. They're not counsellors. They're not psychologists. They don't use the talk therapy method. They're actually a coach trained in a framework, and they've come from all walks of life. And our coaches we've specifically selected to match APS and other Comcare agencies and also the other customers that we have. The service is all about skill building and also guided self-management. So it's really structured and it has some really consistent techniques that focus on the individual's goals and their strength and the practical activities to help them achieve that. There's also continuity of care. So the participant chooses their coach through a digital platform that I'll show you in a sec. And they have the same coach for up to 8 sessions. So they define a problem statement at the initial assessment, and they also define what goals that they want to work towards, and they work with the same coach across each session. Another difference, and I've mentioned this before, is that fidelity and adherence to the specific model of care. So coaches are really purposeful in their approach, and they're also supported by a really robust risk and supervision framework. And then progress tracking and outcomes reporting is a really unique element of this service. So participants weekly can track how they're going in their dashboard on the platform, which really helps with accountability, and also it's encouraging to see progress. And then employers who take up the service get aggregated, de-identified outcomes reports, which show not only the reach, the demographics, and all of that of the participants, but also the reasons for going into the service, which are often about 50% work-related, 50% personal, but also the outcomes that we see, including clinical and non-clinical outcomes. And then the last thing is that the Beyond Blue brand and the non-clinical approach to the service can really overcome barriers for people, employees, to actually use the service. This is an interesting slide about the results that we've delivered, and it's something that Marion referred to earlier. So since we first introduced it into Australia back in 2013, this service has been delivered to 40,000 people across those three settings that I talked about. So community, small business, and then public service and private settings. And there's been some fantastic results. We've actually done a total of 4 official evaluations over that time. So in 2018, when we launched New Access for Workplaces with Comcare, we did an evaluation in 2022 of that by PwC, and that found an ROI of about $1.60. And then also in 2022, we actually had the Small Business Owners Service evaluated, and it performed with an ROI of $1.78. And the results we're seeing since we launched Before Blue last October have been outstanding. So besides some clinical improvements, there's some stats here around people's experience on the right to your screen. So 98% of participants have said that they were happy with the service, and 88% say that their productivity at work has improved. And our current NPS, or Net Promoter Score, is sitting around 80, which is excellent for a healthcare type service. As I mentioned before, our cloud-based digital platform from which your employees can access the service is really secure, and it's compliant with all of the Commonwealth government requirements around IT security and data sovereignty. Our data is all stored on Australian shores. Participants, the process is that they register for a Beyond Blue account by clicking onto their Works intranet and entering into your special code, or by accessing it directly from our website with your code. And then they have their own login from then on, so that they can basically register and have a look at our coaches and their profiles and photos, choose their coach, book their appointments, complete different mental health assessments online before their session, and then attend their appointments via a video call. Some participants prefer to do it over the phone, and we also have that as an option. As I mentioned, we store a record of their mental health progress on the platform, which you can see here, along with various other resources that the coach might send them to read, watch, or listen to as part of their treatment. And we have a whole suite of resources specifically and exclusively for this program. We have 10-minute podcasts, 2-minute videos, PDF workbooks, worksheets, all of those sorts of things. It really helps people keep engaged with the service even when they're not in session with a coach. So I think we're nearly at the end of this one, Urvika, but lastly, if you decide to take up Before Blue and offer it to your employees alongside your EAP, you get plenty of support from Beyond Blue. From the contracting process, with most of the work already done by Comcare, to IT checks to ensure the platform is successfully set up for your people to access it easily. So each organisation has a dedicated account manager, and they provide access to an employee engagement kit with plenty of assets that are constantly being updated for you to share on your intranet and in staff newsletters, etc., to promote the service. And Beyond Blue is always generating new content relating to mental health, so we'll actually share this directly with you as well to provide to your people. And we're also here to offer you presentations to your teams, to talk about mental health and to promote the service. And then when you've signed up as an employer, what can you do to promote the service? Well, you can use it yourself and keep promoting it to your teams when you've had a go at it yourself as a great preventer and early intervention tool. You can have a look at your monthly and quarterly reports. They're quite detailed, and actually work with us to draw out the learnings that you may be able to apply into practical changes within your work environment. And of course, you can see how take-up of the service impacts broader elements such as staff engagement and productivity. So the next slide is about the cost. So the cost for Before Blue for APS agencies is currently $1,270 per person. So that's a package. And for that, they do an initial session. They do up to 5 weekly sessions and then 2 follow-ups to ensure sustainability. And when I say it's currently this amount, what happens is in our arrangement with Comcare is that when total uptake reaches certain thresholds across the scheme, then the price per person actually reduces on a sliding scale. Just on the last slide, we've got a couple of QR codes. So please feel free to, or one QR code, please feel free to click on that and go through to learn more on our website. And I'll hand over to Ervika, who's going to now share a video. And then Marion will talk to Jess from CSRO and Kirsty from DUA. Thank you.
Hi, I'm Bert. This is Before Blue for you, and I'll be your coach for today. Let me walk you through Before Blue, a proven mental health program for workplaces. I'll explain how it works and why it works. How are you feeling? Stressed from the work week? Just had one of those video calls with stuff going on in the background or a shaky Wi-Fi connection. Trying to find time for your team, your manager, your partner, your family, and for yourself. I get it. Our lives are busy and it can be hard to manage stress before it piles up. But Before Blue is here for exactly that, to help you stay on top of everyday worries now and into the future. It starts with you getting in touch with a coach, like me. Across 6 weekly sessions, plus a couple of follow-ups, we'll meet one-on-one and tackle the everyday challenges you're facing. We draw on low-intensity cognitive behavioural therapy, or LICBT, based on decades of solid research and proven methods. It's engaging and hands-on. While you learn, you get practical tools and strategies to start using right away. As you're practicing, you'll see results in your work and in your life. And it works. Before Blue builds on the success of a decade-long program that supported 36,000 people and counting. More than 7 out of 10 employees experienced improvement in their mental health. So how's that sound? Ready to make some changes? Getting started is easier than you think.
One of the benefits, the biggest benefits actually of the program is not only for the individual, but to what Marcia had mentioned before, is that the insights that the program can actually provide. So we know from the feedback collected from participants in the program since the program launched last year, is that it provides holistic support through wraparound care, but also to working with participants to manage both work-related and personal challenges. So what we're seeing, Marcia did allude before and mentioned that it was about a 50% split, but some of the reasons that people are accessing the program are around the demands of the job, role anxiety and interpersonal relationships, and some of the non-work related reasons that people are accessing the services around experiencing of family stress, personal health and caring responsibilities as well. There's also an overwhelming number of participants who are satisfied with the program, 98%, and 98% more importantly, feel heard and understood by their coach, which is so critical, I think, for that therapeutic relationship. It also means they're more engaged. It also means that they're more accountable. So the program really isn't about responding to issues once they've escalated. It's really about early support and preventing longer term mental health outcomes. We're sharing some participant testimonials here. I think any one of us can talk till we're black and blue in the face about the Before Blue program, but I think these quotes really bring to life the experience of the program for these participants. They highlight the potential experience that your employees could also receive from the program and can also benefit from the program as well. Personal accounts also remind us that offering timely, accessible mental health support can make a significant difference in someone's life, and it's such an essential part for creating supportive, safe, and mentally healthy workplaces as well. So in terms of Comcare and what our role is, Comcare is the lead agency that holds the deed with Beyond Blue. And so what that means is that we as an employer are also offering that program within Comcare to our employees. And that we, in terms of expansion and making it available across the APS and the Commonwealth entities, we continue to play an advisory role. We assist and we support various aspects like tailored promotions if needed and information sessions like these as well. And also are able to answer any questions around the deed, which describes the engagement with Beyond Blue, the program, the requirements, the reporting requirements, the prices. So all those details have been negotiated with Beyond Blue. We do receive, so employers do receive monthly reports. Comcare does receive a high level data report relating to program outcomes. And so this really just enables us to understand where the potential challenges are within the Commonwealth entities. It helps inform our promotions, our marketing. It helps us and Beyond Blue look at what we can do differently to improve the program. There are no links whatsoever with or have any impacts to claim or premiums. All the data that we receive is aggregated, de-identified data as well. But very happy to answer any questions in relation to that if there are any further questions or concerns. So in terms of next steps and how to join the program, firstly, it is to contact us beforeblue@comcare.gov.au. The first step is really to receive and to sign that notice of inclusion, and that just communicates to us that the agency would like to access the services that have been negotiated under the deed. And once you complete that notice of inclusion, we will then provide you all the documents required to connect you with the Beyond Blue team. Now, although there's no procurement process as such that you need to follow, there is still the request for quote that needs to be completed. There is still delegate approval required to actually sign the official order with Beyond Blue, but there's certainly none of the release for tender or really a request for quotes that's needed that would normally need to happen. All right, and as always, we are available to meet, I should say, for further information. And if you require any further details before signing the notice of inclusion, we will also have a user guide, which we will forward you following this session as well.